Public health facilities are not only a major source of critical healthcare interventions, but they also consume a significant amount of healthcare resources. One of the most crucial predictors of public health facility success is the healthcare purchasing arrangements, and specifically the mechanisms utilized to finance their operations. The Strategic Purchasing for Primary Healthcare SP4PHC project was initiated to improve how governments purchase primary healthcare services with a focus on family planning and maternal, newborn and child health.
The health financing landscape in Kenya is characterized by a series of healthcare financing reforms. The most recent of these is the introduction of the free maternity service in Kenya and the removal of user fees at level 2 and 3 facilities. Purchasing is strategic if decisions about the allocation of funds is based on information about provider behavior and population health needs in order to maximize health system goals.
Kenya has been on a journey on UHC, and we know that health financing is very critical on that journey, very critical towards UHC. Therefore, looking at the overall financing landscape and defining where we want to go has been one of the critical areas. Looking at the allocations at the county level, at least on average, counties are allocating at least 30% of their budget, total county health budgets to health, although there are a few counties that are below the 30%, but the progress has been good. You know, the general increase in budgetary allocation to the health sector. However, we still do have a few areas of bottlenecks. For example, when we look at the insurance coverage, it's still quite low at around 19%, with private sector insurance taking around 2%. And as we move to UHC, this is one of the areas that the government wants to address.
Quality of care is one of the tenets of universal health coverage. And as the country tries to strive to achieve universal health coverage, then we need to consider about, what is the quality of care that we are providing within our facilities. And that's why ThinkWell came up with this project to try and see, yes, in as much as we are aiming to make sure everyone accesses services, how do we even first of all define quality in Kenya? How can we leverage on a component of health financing, which we are calling purchasing, to make sure that we deliver on better quality care?
Counties have a lot of data in terms of health service delivery, and so we are looking at how we could utilize the data available and the tools that are available. The Kenya Quality Model of Health will be looking at how we can utilize this to then link that to strategic purchasing, and this could be in at NHIF level, to see how we reimburse for services that are offered at the facility level. As a result of the Linda Mama reimbursements, do we have improved maternal health care? So these are some of the parameters that we're looking to answer in our quality capstone.
The SP4PHC project focused on 3 counties, namely Isiolo, Kilifi and Makueni.
We came and carried out a landscaping study that mapped out the entire architecture for health financing to understand how revenues flow, how planning and budgeting processes take place in the county. And we were able to form the first basis for our technical assistance based on evidence.
Our work with ThinkWell, we were helped to look at this issue of health financing so that we are realistic in terms of mobilizing funds for that, because of course funds are limited.
We have also had a very good working relationship with ThinkWell. They help us to map out what is our target for revenue in terms of both Linda Mama, NHIF, and even our own money which we collect from the services that people come when they visit hospitals, which they pay. We have been able to move from about 90 million, and now in a financial year we are collecting up to 130 million.
The Facility Improvement Fund in Isiolo fairly stopped because Isiolo is one of the pilot UHC counties. So with the introduction of the UHC as a big four agenda, number 4, the services were made all free. Because that is a pilot project and it is stopped after 1 year, then what will happen after the project stops? So therefore, we met and started introducing an idea of the previous user fee, but in form of facility improvement fund. How shall we be able to fund our services so that we'll keep the quality of healthcare delivery to the standard that is required?
We worked with the county and eventually achieved that. The bill has been passed, and we say that is the crown jewel of our achievements in the county, because for a foreseeable future, this bill is going to enable them to have that autonomy that they've been seeking.
Kilifi County is one of the low-resource counties and as such faces a challenge of access to maternal and newborn child health. ThinkWell collaborated with Kemri Wellcome Trust and the county government of Kilifi to also improve purchasing arrangements for primary healthcare services, especially family planning, maternal, newborn and child health services.
By our partnership, the facilities from the department are able now to claim funds from NHIF, and there are regular meetings between NHIF and the Department of Health where they discuss on the challenges that they are facing in implementing the Linda Mama program. So far, over 140 facilities within the within the Kilifi County are offering Linda Mama services.
Linda Mama has been a game changer in our community from a different spectrum. We have seen the numbers of skilled deliveries improve from below 50% just about 2 years ago, and now we are at 83%. Also, we are improving on the other indices like the maternal mortalities, the neonatal mortalities. We've seen those also reduced, which again, within the framework of Linda Mama, we can directly attribute that to the program.
Linda Mama imesaidia sana, inawezesha akina mama wasikose huduma, hasa kama za ujauzito, kwa kliniki ya ujauzito, kujifungua. Anapokuja hapa, bora amepata ile namba ya Linda Mama, anajua ya kwamba hakuna pesa zozote zile ambazo ataweza kutozwa. Ile pesa tunapoipata, kuna mambo mengi ambayo tunafanyia hapa. Saa nyingine hata kuna dawa kidogo kidogo zile ambazo tunakosa, tunatumia ile pesa. Pesa ile pia inatusaidia kuweza kufikia wale wateja wetu kule kwa community, kuweza kuwafikia na ujumbe wa afya.
Linda Mama imenisaidia kuanzia ujauzito wangu mpaka sasa nimejifungua. Imenisaidia, sijaweza kulipia chochote, na pia imenisaidia kutunza ujauzito wangu bila gharama zozote, na pia imeniwezesha kuwa na access kwa kila hospitali yoyote ya kiserikali.
Generally, we have systems that can be leveraged to link purchasing to quality, but we need to operationalize them. We need to move from, wanting to do new things to using what we already have to improve the quality of care within the country.
The county government must now move from sitting down for meetings and doing the real thing. So what is remaining is for them to be given this now as a target. They should include NHIF and the Linda Mama services that have been offered there. How much has been claimed, maybe for deliveries, for antenatal, for postnatal. If they include that as a target, as a deliverable, when they're having their meetings, then we will be able to move forward.
We need to ensure that the application of PFM rules and regulations do not obstruct the shared vision of the country in making sure that all people can access quality health services without having to suffer financial hardship. And that's what this program is raising a voice on, both for national government and county governments in the country.